Pulmonary edema is a respiratory disease condition. Look at this picture, shows that lungs, alveoli, capillaries, then chest X-ray findings, CT scan and echocardiography findings. Look at this. A detail going on. Introduction. Pulmonary edema is a life-threatening condition characterized by the accumulation of fluid in the lungs, particularly within the alveoli and interstitial spaces. This fluid buildup interferes with normal gas exchange, leading to impaired oxygenation and breathing difficulties. Pulmonary edema can occur suddenly, acute, or develop gradually, chronic, and is often associated with cardiac and non-cardiac causes. A definition. Pulmonary edema is defined as the abnormal accumulation of fluid in the pulmonary interstitium and alveolar spaces, leading to impaired gas exchange and respiratory distress. Etymology. The term pulmonary edema is derived from Latin and Greek origins. Pulmonary comes from the Latin pulmonarius, meaning of the lungs, and the edema is from the Greek oedema, meaning swelling or fluid accumulation. Epidemiology. Pulmonary edema is a common clinical condition, particularly among older adults and individuals with underlying heart disease affecting millions of worldwide each year. It has higher incidence in patients with congestive heart failure, with hospital admission rates increasing due to aging populations and rising cardiovascular disease prevalence. Types. Types. Pulmonary edema is broadly categorized into 1. Cardiac pulmonary edema caused by increased hydrostatic pressure due to left ventricular dysfunction. Example, congestive heart failure. 2. Non-cardiac pulmonary edema occurs without increased cardiac pressure, often due to increased capillary permeability. Example, acute respiratory distress syndrome, ARDS. Inhalation injuries. 3. Flash pulmonary edema, sudden, severe onset, often related to acute heart failure or severe hypertension. 4. Neurogenic pulmonary edema occurs after acute central nervous system injury, example head trauma, seizures. 5. High altitude pulmonary edema occurs in individuals exposed to high altitude due to hypoxia induced vasoconstriction. Causes: A. Cardiogenic causes. 1. Left side heart failure. 2. Acute myocardial infarction. 3. Hypertensive crisis. 4. Valvular heart disease. Example mitral stenosis. B. Non-cardiac causes. 1. Acute respiratory distress syndrome ARDS. 2. Sepsis. 3. Kidney failure. 4. Aspiration of gastric contents. 5. Drug overdose. Example opioids. 6. Inhalation of toxic gases. Risk factors: 1. Hypertension. 2. Coronary artery disease. 3. Heart failure. 4. Diabetes mellitus. 5. Kidney disease. 6. Obesity. 7. High altitude exposure. 8. Smoking. 9. Alcohol abuse. 10. Use of certain drugs. Example heroin, cocaine. Complications: 1. Respiratory failure. 2. Hypoxia. 3. Cardiac arrest. 4. Pulmonary hypertension. 5. Multi-organ failure. 6. Death if untreated. Pathophysiology. Pathophysiology of pulmonary edema, step-by-step process. Pulmonary edema, through a series of physiological changes that lead to fluid accumulation in the lungs. Below is a step-by-step explanation. 1. Underlying cause triggered cardiogenic, most commonly due to left ventricular failure. Example myocardial infarction, hypertension. Non-cardiac, triggered by conditions such as acute respiratory distress syndrome ARDS, sepsis or trauma. 2. Increased pulmonary capillary pressure or permeability. Cardiac elevated pressure in the pulmonary capillaries due to backflow from a failing left ventricle. Increased hydrostatic pressure. Non-cardiac injury to alveolar capillary membrane increases capillary permeability. Example due to toxins, infection. 3. Fluid moves into interstitial space when the lymphatic drainage system is overwhelmed or unable to remove the excess fluid. It begins to accumulate in the pulmonary interstitial space. 4. Fluid spills into alveoli. As fluid continued to accumulate, it crosses into the alveolar spaces, displacing air and disrupting normal gas exchange. 5. Impaired gas exchange. Oxygen diffusion is severely reduced due to fluid filled alveoli, leading to hypoxia. Low blood oxygen levels. CO2 removal may also become impaired in severe cases, causing hypercapnia. 6. Symptom manifest. The patient develops dyspnea, cough with fruity sputum, crackles, tachypnea, and other symptoms due to impaired respiratory function. 7. Compensatory mechanisms activated. The body tries to compensate via tachycardia, increased respiratory rate, and activation of the sympathetic nervous system, which may further exacerbate the condition if left untreated. This process can lead to respiratory failure if not promptly recognized and managed. Signs and symptoms. 1. Respiratory symptoms including dyspnea, orthopnea, cough, tachypnea, cyanosis, wheezing. 2. Cardiac signs and symptoms tachycardia, elevated blood pressure, hypotension, 3 other anxiety, cold, clammy skin, fatigue, confusion, diagnosis. 1. Clinical assessment, history, physical examination. 2. Imaging, chest x-ray, bat wing appearance, fluid in alveoli, CT scan. 3. Laboratory test, arterial blood gas, ABG, hypoxemia, BNB. B type, nucleotic peptide, elevated in cardiogenic type. 4. Cardiac test, ECG, echocardiography. 5. Pulmonary artery catheterization. To differentiate cardiogenic from non-cardiogenic cases. Nursing diagnosis. 1. Impaired gas exchange related to fluid accumulation in alveoli. 2. Ineffective breathing pattern related to alveolar capillary membrane changes. 3. Decreased cardiac output related to altered preload and afterload. 4. Anxiety related to dyspnea and hypoxia. 5. Risk for fluid volume excess related to compromised regulatory mechanisms. Medical management. 1. Oxygen therapy, nasal cannula, face mask, or mechanical ventilation. 2. Diuretics, example furosemide to remove excess fluid. 3. Vasodilators, example nitroglycerin to reduce cardiac preload and afterload. 4. Morphine, cutiously used to reduce anxiety and preload. 5. Inotropic agents, example dobutamine for severe heart failure. 6. Antihypertensives if hypertension is present. 7. Treat underlying causes, example myocardial infarction, infections, etc. Nursing management. 1. Monitor vital signs, respiratory status. 2. Elevate the head of bed. 3. Administer medications as prescribed. 4. Monitor intake and output. 6. Provide emotional support. 7. Educate the patient on lifestyle changes. Examples: salt restriction, fluid management. 8. Frequent asculturation for crackles or wheezings. 9. Prepare for possible intubation, mechanical ventilation if condition worsen. Treatment options: 1. Oxygen therapy. 2. Diuretics. 3. Vasodilators and morphine. 4. Non-invasive ventilation. 5. Mechanical ventilation for severe cases. 6. Treat the underlying condition. Psychosocial medicine. 1. Emotional support and counseling. Address fear and anxiety associated with breathlessness and hospitalization. 2. Patient and family education regarding condition, lifestyle changes, medication adherence. 3. Support groups for patients with chronic heart failure or pulmonary disease. 4. Cognitive behavioral therapy CBT to manage anxiety or depression resulting from chronic illness. 5. Social services referral for home health services, financial support, or community resources. Prevention. 1. Management of chronic conditions, control hypertension, diabetes, and heart disease. 2. Adherence to medications, especially in heart failure patients. 3. Limits fluid and salt intake, especially in patients at risk. 4. Avoid high altitudes if predisposed to HAPE. 5. Lifestyle changes. Smoking cessation, weight management, regular exercise. 6. Regular follow-up care with a cardiologist or pulmonologist. In conclusion, pulmonary edema is a serious medical condition that requires prompt recognition and management, whether stemming from cardiac dysfunction or non-cardiac causes. Early intervention can significantly reduce morbidity and mortality. Healthcare providers play a crucial role in monitoring, intervention, education, and providing psychosocial support preventing strategies, lifestyle modifications, and patient empowerment are essential to improve outcomes and reduce recurrence. Thank you. Have a nice day.